everyone. My name is Beth McGinty, and I'm the Associate Director of the ALACRITY Center for Health and Longevity and Mental Illness at Johns Hopkins. I'm here today giving a seminar titled Using Mixed Methods to Inform Causal Inference. As I mentioned, I'm the Associate Director of the Johns Hopkins ALACRITY Center, and our focus is on improving physical health and reducing premature mortality among people with serious mental illnesses like schizophrenia or bipolar disorder. This lecture is part of the center's methods series. Our center has a methods core focused on developing and disseminating new methods with a focus on methods that help to scale up evidence-based interventions that have been shown to be effective in the lab or in clinical trials, but are not yet disseminated in real-world settings. And we're focused, as you see on this slide in the second bullet, on translating evidence-based interventions to reduce premature mortality among people with serious mental illness into community mental health settings. Most of our initial work is in Maryland, but our eventual goal is to bring this work nationwide. Our center is funded by the National Institute of Mental Health for 4 years. In this lecture, I have two sections, really three sections, and that the second section is broken into two subsections. First, in section 1, I'm going to talk about the motivation behind this lecture on using mixed methods to inform causal inference and give a very high-level introduction to mixed methods. In the second section, I'm going to walk through an applied example of using mixed methods to inform causal inference. And that example is focused on Maryland's Affordable Care Act Medicaid health home waiver for people with serious mental illness. I'll split this up into two components. Section 2A, the qualitative and survey component of this example, and section 2B, the non-experimental policy evaluation component. Moving now into the section on motivation and the high-level introduction to mixed methods. In public health, we often want to know whether a policy or program worked. And by worked, I mean met its intended goals. Did the school-based health education program lead to healthier diet? Did the new healthcare policy increase access to primary care services, etc.? Sometimes we can get at that did it work question by testing the intervention in a randomized clinical trial, which is, of course, the gold standard for making causal inference. Often, however, we can't do a randomized clinical trial. I'm a policy researcher, and this is often the case with public policy. We can't randomly assign people to public policies, which are passed often by state legislatures or city councils. In addition, sometimes even when we have tested an intervention in a randomized clinical trial and shown in the trial context that it, quote, worked, we know that that intervention might not work when we try to implement it outside of the clinical trial context in the real world. And there are a lot of different reasons for that. The core idea here is what's often called in the literature voltage drop. And this is the idea that in randomized clinical trials, we're operating at very high voltage. There's a lot of highly trained research staff putting a ton of energy and attention into trying to make this intervention work. And often the intervention is pretty well resourced, funded by a large NIH grant, for example. Then, in real-world settings, a lot of that voltage drops off. Less resources, staff might have multiple conflicting priorities, including but not limited to this intervention, etc. So all of that is motivation for using non-experimental methods for making causal inferences, even if we've started with a clinical trial suggesting that an intervention might be effective. There are a lot of different non-experimental methods for making causal inference, and these methods themselves are not the focus of this specific lecture, but they are the focus of other lectures in this Alacrity Methods series by Elizabeth Stewart and Sachini Bandara. Some examples, which I'll just allude to briefly, of these types of methods are difference in differences, marginal structural models, trial emulation, and propensity score weighting, among others. So now that I've told you what isn't the focus of this lecture, what is the focus? The focus today is to think through how we can use mixed methods to improve our ability to make causal inference when we're operating in that world I just alluded to, that's often the case, particularly with policy, where we have to use a non-experimental policy or program evaluation. As promised, here is my very brief overview of mixed methods. Mixed methods at a high level is just what it sounds like. It's a research approach where researchers analyze and collect multiple different kinds of data. The hallmark of mixed methods is using both quantitative and qualitative data in the same study. Quantitative data being any kind of numeric data, qualitative data being things like interviews or document review. Text instead of numbers is a simple way to think about it. I've included on this slide a screenshot of a great short piece by Allison Shorten and Joanna Smith, as well as the reference listed below. This is a 3-page, very high-level introduction to mixed methods research and a great resource if this topic is unfamiliar. There are various types of mixed methods design, and I will walk us through 4 on this slide. These are by no means the only 4 options, but these are 4 core designs. First, an explanatory sequential design, which is often demarcated with the notation you see here, quan, and then an arrow pointing to qual. So quantitative followed by qualitative. In this design, a quantitative analysis happens first and is followed by a qualitative analysis. In this case, the goal of that secondary qualitative analysis is to help explain the results of the quantitative analysis, thus explanatory sequential in the name. Exploratory sequential designs are just the opposite, where qualitative happens first, followed by a quantitative analysis. And here, the idea is that the qualitative research might generate hypotheses that you can then test using quantitative methods. Another option is a parallel design, which is just what it sounds like. In this design, we do qualitative and quantitative research simultaneously. And the idea here is that you're using those 2 methods to answer related and complementary, but slightly different research questions. Finally, the 4th design that I'll highlight is a nested design. And in this design, the core idea is that one of the 2 types of methods is primary and the other is nested within it. So a principally quantitative study, for example, a randomized clinical trial, and then within that principally quantitative study, you've nested a qualitative sub-study, perhaps in this example, interviews with clinical trial participants to understand their perceptions of the intervention being tested.